everyone, I am Beatrice. In today's video, I'll be explaining asthma in such a way that it will be very clear and easy to understand. As we progress in the lecture, I'll be making reference to some points you need to take note of for your nursing school exam and for your NCLEX. So stick around, let's dive in. So asthma simply refers to a chronic inflammatory condition of the airway. This disease condition is commonly seen in children between the ages of 3 to 8 years. So it's more like a childhood disease, but it can progress even up to adulthood. It is chronic, that means it's going to be a lifetime thing. So it's not going to be something that just come and you treat it and it disappears. The disease can have a period of exacerbation. That means there will be a period where they will have attack when they are exposed to some triggers, which I'll be looking at shortly. First, let's review the anatomy of the respiratory system briefly. We know that the respiratory tract has both the upper respiratory tract and lower respiratory tract. The upper respiratory tract begins with the nose and the nasal cavity to the pharynx, which is what we call throat, and then to the larynx, the voice box. The lower respiratory tract begins with the trachea, which is called the windpipe, and then as it goes down into the lungs, it bifurcates into two branches, which is the right and left bronchus. Now, these bronchus also bifurcate further into smaller branches, which is what we call the bronchioles, and this one terminates at the alveoli, which is the air sacs. This is where the actual gaseous exchange between oxygen and carbon dioxide occurs. Looking at this anatomy of the respiratory system, the bronchi and the bronchus are the most commonly affected in asthma. Now, the pathophysiology of asthma, I'm going to break it down in simple 3 phases to make it easy for you to understand. It begins, first one is with a trigger, which will lead to inflammation and finally resulting to decreased ventilation. So the first phase, which is the trigger, it begins with something that causes irritation to those airways, to the lungs. Anything that's like an irritant, we can call it precipitating factor. So as the name goes, trigger, something that trigger the body to react. Now, these triggers are unique to individuals. Somebody may have asthma, another person may also have asthma, but their trigger may vary. However, there are common triggers that you want to note. Now, these include things like dust, like mites, pollens, infection, like when they are having respiratory infection, like common cold viral infection, they can trigger asthma attack. Poor air quality, let's say there is smoke around, maybe you are cooking or you are frying something and something got burnt, it can trigger an attack. Even cigarette smoke can trigger an attack. Now, there are other things that can even trigger attack, like animal danders, like the fur of animals like dog, cat, and even animals itself, like cockroaches. It can trigger attack in some patients. And another thing is even exercise. Some patients have discovered to be triggered by exercise. When they do any exercise and they begin to experience this attack. So there are so many triggers depending on how unique it is to the patient. Once there is a trigger, the next thing is the body is going to react. That's the second phase. And the body is trying to react, the immune system is swung into action. Now, during inflammation, several things happen. The first thing is there's going to be increased production of mucus. So normally in the lungs, there are mast cells. These mast cells, they line the lungs, but when there is a trigger, they begin to release their chemical mediators, like leukotriene, like histamine. And then once this happens, the leukotriene will also further stimulate the goblet cells, which are mucus-producing cells. These mucus-producing cells increase in number and begin to produce more mucus, causing clogging of the airways. As this mucus increase in production, the leukotriene also are going to stimulate those smooth muscles around the lungs and the airways, causing the bronchioles to become tightened and constricted. Now, once they become constricted, it's going to further narrow the airway. Then another thing, there will be increased vascular permeability, leading to accumulation of fluid, edema in the lung spaces. Then this will lead to the third phase of the pathophysiology, which is decreased ventilation. And that makes sense if in the lungs there is swelling, edema, accumulation of fluid, there's mucus production, and there's bronchoconstriction. All these are inflammatory response. All these are going to lead to decreased gaseous exchange. So there will be reduction in the movement of air, oxygen coming in, and carbon dioxide leaving. So that would be the third phase, decreased ventilation. Now with decreased ventilation, the patient is going to begin to manifest all the signs and symptoms of asthma. Now, the signs and symptoms of asthma begin with expiratory wheezing. Actually, it's going to be a prolonged expiratory wheezing. So when you hear them, you will auscultate their lungs. You'll be hearing a whistling sound, like if you're playing a music. So you'll be hearing that whistling sound, and it's going to be prolonged on expiration. It's very important. It's a classical sign of asthma. The next thing is, of course, there will be dyspnea, difficulty breathing because of that decreased ventilation where oxygen is not able to properly get into the lung. The patient is going to be experiencing problem with breathing. They will even be feeling short of breath. And also because of that accumulation of fluid, the constriction, and those mucus that are just clogged up in the airways, it's going to cause dyspnea, difficulty breathing. And they're also going to experience chest tightness. They'll feel tightness in their chest. And then coughing is another sign in asthma. Of course, that's because of that increased mucus production. So the body trying to clear that up, the patient begins to cough. And then tachypnea and tachycardia. Tachypnea has to do with increased respiration, of the body trying to kind of compensate, trying to see how they can solve this problem. Is going to lead to increased respiratory rate and increased heart rate. And then the patient is going to feel anxious. They're going to feel like this feeling of impending doom. So they will be sweating, they will be restless. So you could notice those signs and symptoms. And also, as this condition continues to worsen, they may begin to use the accessory muscles to breathe. They could also experience what we call paradoxical breathing, where the chest expansion and the abdominal expansion, the diaphragm is not moving in the same direction. They could experience that. And then, as this condition also worsens, air trapping could occur. It's obvious, right? So when there's mucus clogging those airways and everything is constricted, oxygen is not able to get into the lungs, and the carbon dioxide that is supposed to be a waste product of respiration that should be coming out is stuck in there. So there's air trapping. And as this carbon dioxide accumulates more in the system, it can lead to buildup of acid in the system, causing acidosis. So there are CO2 retainers. Then, if this continue, the acidosis and all the problem continue, air trapping continue, they will experience what we call silent chest. So you need to take note of that. So silent chest means absence of breath sound. It's not a sign of improvement, because when you are treating them, usually with time, those wheezing begin to clear off. But in silent chest, there will be no breath sound. So don't think they are getting better. That means there's a big problem. The airways are beginning to be cut off. So it needs an urgent attention. Now, the diagnosis of asthma. So to diagnose asthma, there are several tests that need to be carried out. It includes things like pulmonary function tests, also arterial blood gases analysis, what we call ABG analysis. So remember I said they be in respiratory acidosis. Now, patients that have acute asthma, or they are having an attack, when they check their arterial blood gases, they will experience low oxygen in the blood. That's because of that poor exchange. So that's what we call hypoxemia, low oxygen in the blood. And the carbon dioxide in the blood will be high. So they will experience hypercapnia. So that is the unique thing about the arterial blood gases. So they can use that to diagnose asthma. Then they also do chest radiograph, chest x-ray to look at those structures to see the constriction in those airways. Now, the other tests that can be used to diagnose asthma include things like spirometry and peak flow measurements. These two also follow the same pattern of trying to encourage the patient to do as much as breathing out, expelling air as much as they can do forcefully from their lungs. But for peak flow measurement, it's both diagnostic and also used to monitor how they are progressing in the management of the asthma, how they are able to control their asthma. I'll discuss it shortly, how to teach the patient to use peak flow measurements. Now, the management of asthma. In managing asthma, we have the nursing intervention, what you as the nurse will be doing, and medication. Of course, the nurse will be doing so many teaching and will also be administering all the prescribed medication. So first, the nursing intervention. Now, as the nurse, a patient is admitted and is having attack, is having that exacerbation. you're going to be positioning them properly. Very important. The patient should be sitting upright in Fowler or even high Fowler's position, 90 degrees. They should be sitting in such a way that there's room for the lungs, the airway the lungs to expand, to increase that interthoracic cavity and allow as much air to get into the lungs. If they are not properly positioned, the oxygen, if you are giving prescribed oxygen, may not get there, and there will be no enough space for the lungs to expand. That's the first thing. And also, as you are doing this, you are assessing them. You are going to be listening to their lungs to check, to see the wheezing, the extent of the wheezing, the breath sound. You'll be auscultating the lungs. And at the same time, you are going to reassure them, keep them calm, because as at the time they are feeling that anxiety, they become so fearful, it can worsen the condition. So you try as much as possible to keep them calm, maintain a calm environment for them, reassure them while you are examining them. Then also, you'll be doing a lot of administration of medication that are prescribed. You will be administering prescribed oxygen to help as much oxygen to get to the lung and blow off CO2. At the same time, you will be doing a lot of teaching, because some of them get this trigger because they are not managing their asthma very well. They are exposed to this trigger and get this attack because they are not managing their asthma well. So you'll be doing a lot of teaching centered around the use of medication and how to manage their asthma, because some of them can be experiencing this attack when they are not managing the asthma well. They are exposed to triggers. Some may not identify those triggers. So when you examine them, take detailed history, you may be able to identify some of those things. And the patient can easily tell you that, oh, whenever I'm around the environment where there are pollens or dust or mites or animal danders, I feel this attack, this chest tightness and all that. So you'll be teaching them all those things. Now, part of the teaching too, you are going to teach them, for those that are induced by exercise, teach them to take their bronchodilators, especially the short bronchodilators, 30 minutes before the exercise. You're going to teach them to go with their inhalers all the time. Keep it in strategic places in their handbag, at home. Even at home, they should keep it in different places. They should have more than one in their car, so that anytime they get this attack, they should have something to quickly relieve them. They need their short-acting medication. You will teach them how to use peak flow meter. Now, the peak flow meter, teach them to use it 3 times and record the highest number. That highest number is going to show how much they're able to forcefully breathe out, expel air. It's going to help to keep their lungs expanded. Now, you teach them to use it at least once every day, early in the morning before they take their bronchodilators or any of their medication. When teaching them peak flow measurement, you should teach them to zero the reading. Now, when they zero the reading, they should try to forcefully blow air, like breathe as if they are trying to forcefully expel air from their lungs. Just picture when you are celebrating a birthday, they ask you to blow out your candle. That pop sound, they should give it forcefully at once. That's how they can forcefully expel or breathe out air from their lungs. We are also going to teach them about how to use a metered dose inhaler, and possibly they should use it with a spacer. The advantage of using it with a spacer is to help get as much of the medication into their lungs and to reduce the risk of infection like oral thrush. So you need to teach them how to use their metered dose inhaler. They should take off the inhaler cap, making sure the mouthpiece and spray, making sure the hole are clean. Then they should shake the inhaler about 10 to 15 times. And then, without using the inhaler, they should take in a deep breath and breathe out completely. And then they should hold the inhaler upright close to their mouth, wrap it around their mouth, the mouthpiece, and then breathe slowly in while pressing down on the inhaler. Then when they've pressed down, they should hold their breath for 5 to 10 seconds. So basically they should count like 1 to 10 in their mind, and then they can now open their mouth and breathe out slowly. So that's how to use a metered dose inhaler. So we've come to the end of today's lecture. If you find this video helpful, please like, share, and subscribe for more content. See you next time. Thanks for watching.